You must be careful about the words you use, or the words you allow to be used in your house. Words are things. You must be careful. Careful about calling people out of their names, using racial pejoratives and sexual pejoratives and all that ignorance. Don't do that.
It's time to talk about it.
Pull up a chair and take a seat.
We're serving up recipes for life.
With Hampton University's Dr. Richard Mason and Dr. Tamara Williams.
Welcome to the Sunday Brunch.
This is Dr. Tamara Williams.
And this is Dr. Richard Mason. Welcome back to another edition of Sunday Brunch with the good doctors.
The good doctors.
So good to be back at the table. You know, my appetite is ready.
Ooh, hungry.
I'm a big boy, so I love to eat. So I never miss an opportunity to sit at the table.
I don't know why you be telling people you a big boy.
I am. I own this.
I tell you what, it don't matter how other people see you. It really is how you perceive yourself.
Listen, I'd probably be 160 pounds and still be a big boy.
That's what
you hear
I'm
what I
telling
say?
you. It doesn't matter how other people say about you. It's really what you say about yourself.
I've been a big boy since I was in fifth grade as a big boy.
Look, you ain't as big as you have been either.
No, I haven't.
See, that's what I'm trying to say.
Yeah, that's true. That's true. God is good.
Ain't he though?
He's in the blessing business. He takes the calories out of things sometimes.
No, you got jokes. I would say early on a Sunday morning, but it's not quite early.
No, it's not. So hopefully everybody has gone to church, got the word, and now it's time to eat.
It is time to eat. And we have a great conversation for our guests today and for our listeners today. We have a great conversation.
I'm looking forward to it. But I'm on my way to get that bacon.
Please,
you know
where
I go.
know.
I got your honey butter and your biscuit.
That sounds good to me.
All right.
Today we're going to be talking about a conversation. We seem at our table to cover all type of things from the beginning all the way to the end. We've talked about birth all the way to death, and so we're back at the beginning again. We have a different conversation, however. Last time we were talking about birth, we were talking about doulas. Today we're going to meet a black midwife. And so our people need to know there's different options out there. There's different things that they can do.
Well, I need to know what the difference is.
I know I'm done having babies. Let me be clear. However, there's people still out there populating the universe.
The Lord might say otherwise. Hey, I'm going to just put that in the air.
I rebuke it, Jesus. We almost had to cut. We almost had to cut in the middle of the show.
She looked like she about to flip the table over.
You understand me? Just like Jesus did when they was trying to sell stuff up in there. Do not be trying to sell that to me. I want no parts of it.
Yeah, I probably have to check myself in. I will say that.
I'm going to tell you, come see about me if that becomes a story. Come check on your girl, because the strong will become the weak.
Listen, I got you.
That's not for the faint of heart, for sure. And I'm in the business of understanding that just because you can does not mean that you should.
That's right.
It does not mean that you should.
There you go. You might be able, but that means don't do it.
Don't do it. It is not. Jesus himself would need to descend to have a conversation with me and tell me that is my walk. He going to have to pick me up.
All right.
We going to see his 2 footsteps, because I can't walk that walk.
Kicking and screaming. That's all I'm going to say.
Let's change the subject before it becomes reality. But we're going to get back to the topic of why we are here today. Birth is 2 things are certain in life, birth and death, right? So we know there's a lot that happens in between those time frames, but just getting there, I'm happy to have the conversation with Nicole. So we want to welcome to the table Nicole, and I say it's Wardlaw, Nicole Wardlaw.
Yeah, that's
yes. Welcome to the table,
right.
Nicole Wardlaw.
I'm glad to be here. Thank you.
Welcome to Sunday Brunch.
Yes, welcome. Well, I want to first find out. Well, tell us what, in terms of your definition, what a midwife is, and then we'll start talking a little bit about some other things. I want to know the difference, because I said we didn't have the doulas on here, and so I just want to know kind of the difference.
What is a midwife?
So technically the word midwife means with woman. However, there are different pathways to midwifery. I'm a certified nurse midwife, so I do more than just birth. I do primary care, women's health, annual exams, STI testing, treatment, the whole gambit.
You're a certified nurse midwife. How do you become a certified nurse midwife?
I went to school for a long time.
Do you go to school to be a nurse and then you get certified? Or?
The pathway that I chose, I became trained in the two disciplines of nursing and midwifery.
Okay.
So that is how I became a nurse midwife. So I got my BSN in nursing, and then I got my Master's of Science in nursing with a concentration in midwifery. And then my craziness went back to school, and I have my doctorate. So I have a doctorate in nursing practice. But you don't
So
have
it's
to have
Dr.
a-
Nicole.
Law.
Yes.
Oh,
You can put a
well,
little respect on that.
All right.
Let's talk about that. Yeah. There's only doctors at the table too.
Exactly.
But no,
Yeah.
for C&M, the entry and certified midwives, we're AMCB certified. Which means the American Midwifery Certification Board. That's one pathway, and we get a master's degree, and our scope of practice expands more than just prenatal care, birth, postpartum care, newborn care. It also includes primary care as well as gynecological care.
That's
So
great stuff.
I can do procedures, all kinds of stuff.
As a midwife?
Procedures? Yeah.
So abnormal paps, I do colposcopies, endometrial biopsies. I do IUDs, IUIs, fertility workups. Our scope, and even my scope of practice includes transgender care. So I can do all of that because primary care, we're technically primary care providers
As a midwife.
as a midwife.
She is teaching us today at the table. Do you understand?
But that's the pathway I chose. But there are other pathways. So people in the United States, you have certified nurse midwives, you have certified midwives, which we're both trained the same and we take the same exam. And then you have NARM certified midwives, which are the certified professional midwives. And then you have traditional midwives that are not certified or regulated, but they do an apprenticeship model of
So
training.
they work under someone who is then certified, and they're able to. Okay.
Well, that person may or may not be certified,
Wait a
but
minute.
traditional midwives and certified professional midwives, you have to have a preceptor for them, and they also sit for boards and take a test. Traditional midwives are a little different in the way that they believe that their relationship with their client is very organic, and you don't need a piece of paper or regulation to dictate their relationship. So we have different type of midwives out there, but at the end of the day, all of us are clinical. All of us can diagnose. All of us do the management part of care. And that's the difference between midwives and doulas. Doulas are there for emotional and physical support. We're there for that clinical piece. So,
And you're seeing people who have not maybe been trained or certified in that still do and operate in that area.
well, all of us are trained
Okay.
in some capacity. My training might have been different than another person's training, but at the end of the day, most of us that are out here practicing that have a license have passed boards, have gone through some type of process.
Well, I'm just floored, because my take on midwives are, you're watching those old movies and somebody's about to have a baby and they holler, "Go get the midwife," and she walk in and say, "Boil some water, get some towels." That's what I was thinking. But here you're telling me that you all can diagnose, you can do
A slew of treatment.
I'm just writing it all down here.
Treatment.
Okay.
Absolutely.
So you basically can set yourself up like as a women's health center, so to speak, where a place where women can go from, the moment they find out they're pregnant, even when you're talking about just testing for some of the STIs and some of the other things or whatever, if they wanted basically not to see a traditional doctor, OBGYN or something like that or whatever, they could come to someone who is a midwife and get the same quality of care.
So I'm going to be very biased and say that our quality of care is very different.
Oh, you better hold up your
And
banner. All right.
we are, the hallmark of midwifery is that we listen to our clients. And so our visits are longer. They are very patient-centered. We participate in shared decision-making. We speak with our clients. We do not talk at the clients.
That would
And
be very helpful for African American women when we're thinking about the health disparities and how we're the least protected in that system. So
Oh, absolutely.
I can imagine. How
Absolutely. Midwives have been proven to reduce healthcare disparities. There was a study, it was about the midwifery integration into the systems. And what they found is that the more that midwives were integrated into our healthcare systems, the reduction of healthcare disparities happened. And so I'm one of those people who strongly believes in increasing more midwives, that I'm doing a whole lot in the work of workforce development, and I want to reduce the disparities, especially in the Black community. Black maternal health, there's a crisis. We are dying. We are dying. And
Indeed,
so
that's why I said I was done.
listen, Black midwives, we have come together and we said, you know what? Nobody is helping us. Nobody cares about us. So we are the help that we want to see happen, right? We can only take care of ourselves. So there are not a lot of us. We only comprise probably about 5 or 6% of the midwives out there. But we do the work. We definitely do the work.
How would someone find a midwife? How would they know about what you do?
Well, most of my clients, so I have my own practice,
Okay.
and my clients find me. They do Google searches, word of mouth. They get in these groups looking for looking for people who are aligned with their belief system, and that's how they find me.
What are some points that if someone were Googling that you may trend on? Like,
Black midwife.
okay.
Okay, and what's the name of your company, your practice? You know, you didn't say that. You didn't throw that out there. You know what I'm saying? But we're going to put it on
Okay,
out
well,
there.
shameless plug.
That's not shameless. If
Jami
you do
Birth
what-
and Wellness Services is my business.
Say that again.
Jami Birth and Wellness Services.
Now, how do you spell that?
JAMII. It is, Jami means community.
Okay.
And so when I decided to move outside of the hospital system, I was a hospital midwife for about 15 years when I decided to work parallel to the system besides inside of the system and offer services to people who were afraid of being in our system. So I decided to move into the community, and Jami means community.
Okay, where are you located?
I'm in Chesapeake, in the Western Branch area of Chesapeake.
Okay.
So not too far from Hampton. I got a lot of clients that ride through that tunnel and come see me from over on this side.
And what do you accept? How do they pay?
So self-pay is always an option, but I do accept Medicaid. I accept TRICARE and many private insurances. So that is how I set up my practice, because I wanted to make sure that I was going to serve the community and be accessible to people in the community. And I will even take people who, if they need to establish care, especially during pregnancy, even if they don't have anything, I will take them in, get that pregnancy confirmed, and get them started with care, even with an inability to pay. I feel like we'll catch up on it on the back end. When I open this practice, I ask God, don't let me be ever homeless or hungry. But if I can serve my community, then that's what I want to do.
This is awesome. Well, let me ask you, because my brain is working, because I remember years ago I had a client come in, and she had a lot of anxiety around hospitals and doctors and things of that nature, because her mom went in for some routine checkup and died. Her grandmother went in for something simple and died. Her sister went in for something simple and died. And so this was all in a matter of like 8 years. And her thing was, I'm not going to the hospital.
For nothing.
Absolutely nothing, you know. And she had talked about not having gone to get her normal pap smear and stuff like that. And she came in because her friends were like, hey, listen, you need to get some help because you're going to need to go to the doctor to get yourself checked out just as a regular checkup. I mean, she would not go to the hospital. She wouldn't go to the doctor. She just had a fear and all or whatever of going. And the reason why she came in at that time, because, of course, she thought she was pregnant. And it's like, you need to see somebody, you know. And so she's like, well, I have 8 months for you to convince me, doc. And I'm thinking to myself, listen, you may have less than 8 months to be truthful, but it's good to know that this type of service exists, to be able to say, hey, listen, there are options. And just out of not knowing, I had no idea. Like I said, my mindset and thought of a midwife was certainly boil some water, get some towels. That was me. But I'm amazed. And what's the name of this company? Jami, and say it again. I like to put stuff out there so people will know who they're looking for.
Jami Birth and Wellness Services.
Jami Birth and Wellness Services over in Chesapeake, Western Branch.
Yes.
All right. So listen, so y'all don't have to Google black midwives. You can Google Jami right away, so you know exactly who you're looking for. I think that is awesome.
I want to go back though. How before Jami, you said you were in a traditional setting and then you start working parallel. How did you know that you wanted to do this in the first place? Because this is Black History Month. Next month is Women's.
Every month is Black History Month.
Hello, somebody. Let's say so.
I'm just going to put that out there, y'all.
We making history every day.
Exactly.
Every day.
But, it's not something that we, as doctors at this table, have been exposed to in the many years that we have behind our belts. And so it's amazing for kids even to know that there's different ways and different options of things to do. How did you know? How did you get into this track?
Well, so what happened was I was interested in OBGYN, and I was living in a very small town in South Carolina, and there was a midwife who was that was the only person in this rural area that was doing prenatal care. And so my personal doctor said, well, if you're interested in OB, why don't you go talk to her, see if you can shadow her or just get some information, because everybody doesn't necessarily align with obstetrics and gynecology. And so I went and I met her, and I said, oh yeah, this is exactly what I want to do. Because the training for OBGYNs is a lot of surgery. I always say very jokingly, but also very seriously, that OBs they're surgeons. They're trained in pathology. And so when we look at health, it's normal until proven otherwise. Pregnancy is a very normally occurring thing until you become high risk and risk out, Whereas OBs and physicians look at pregnancy and other things as pathology. And the only way to cure the pathology is for the delivery of the baby. And so I'm like, this is nature. This is what has been ordained. How can we look at that as pathology? So I had to change my thinking because I was headed down the path of becoming a physician. You don't see birth as a
problem that requires that type of solution?
No.
Gotcha.
Until it's proven otherwise. There are people who do wind up becoming high risk. There are people that have risk factors where they need to have more testing or treatments or whatever. But if a person is normal and healthy, then we let them be normal and healthy. And so when I met her and shadowed her, I said, oh yeah, no, I don't want to go to medical school. And my family being, very rooted in the Black community, they were like, well, why would you want to be a midwife? That's something that's olden. You're smart enough, you could be a doctor. And so I, with my little mustard seed faith, went on to school and chose that pathway. And then it wasn't until I graduated that my mother and my other family members saw the vision. And my mother was caught by a midwife back in the day. She was a nurse midwife at that.
You said your mother was a nurse midwife?
No, she was caught by a midwife. Everybody in that community saw my mother, my father, all of them in their communities had the midwife was the norm versus the exception. So when I wanted to go back and become a midwife, they were like, "But why would you do that?" Because they're thinking about olden days, you know. And so when you move from being in rural South and everybody migrated
Because you
north,
took us rural. Because she said caught by a midwife.
Right, right.
She took us all the way back there. I was caught by a midwife.
exactly. But I'm
Okay.
telling you, so when people migrated north, they thought, well, we arrived. We've integrated into the hospitals. We no longer need to breastfeed our babies because we can afford a bottle and we can give them some formula. And so I took that back, and my family at first was like, "What are you doing?" But then once they saw what I was doing, they understood the vision, and they understood that historically, when we had midwives in our communities, right? Midwives were the healers. It wasn't just about catching the babies, but midwives like Maud Callan, they did the TB testing, they did the bone setting, they did the immunizations, they did everything in our community because we didn't have any other healers to take care of us, but it was the midwives that were the healers. And so I wanted to capture that again because I felt there was honor and respect in what the midwives did in our communities, and they were eradicated. Racism eradicated the midwives. Those midwives didn't lose babies and they didn't lose mamas. But when they became eradicated, now with all of this technology that we have in our country, all of these strides and efforts and all this other stuff, why is it that we're dying? We have all of this, but we die. But when we had midwives, there were no deaths. So for me, it made sense that this was the pathway in which I would choose.
So you're saying now that the babies that you're delivering they're not dying, or?
Knock on wood.
I find that very interesting because there's very few things in the whole wide world that are at
I'm not putting that on me, but oh no, I have
Yeah.
not had losses. My babies, I was just doing my stats for last year. My babies are fat, juicy babies. Even one, are they making to full term pregnancies, or Absolutely.
are you losing some in the way?
No, I don't have any low birth weight babies. My babies have not been preterm. I've had even one that risked out. Her baby was growth restricted and still came out about 6 pounds. And I said, look at that.
How do you monitor the babies? Do you still use what they use in the hospitals to do that, and you just have that there in your place?
So the care is still the same in terms of the timetable. I still see my clients on a regular basis. I listen to them with a Doppler, or some of my clients don't like Dopplers, so I have a fetoscope in which I can listen to the baby's heartbeat. I still monitor. I still do measurements, and we put hands on the belly. We feel where the baby is. We talk to our clients. My visits are between 30 minutes to an hour, and we do a whole lot in the way of talking about nutrition, what's happening with them, their mood, their stress.
Do you do blood work?
Absolutely.
Okay.
So you still use technology and modern medicine. See,
that's why I want to ask those questions. Yeah.
Absolutely. All of that is included in what we do. You use the tools that you have to make sure that you have good outcomes. I think the only difference is that I don't shuttle people through. It's not like herding people through. And when I get clients that transfer to me, their biggest complaint is they didn't feel heard or seen. That they just showed up. The people didn't know anything about them, didn't know even their names sometimes. And they didn't feel comfortable being in a place where they weren't being honored. They weren't being listened to, that no one spoke to them about what was happening with their babies. First-time moms are very anxious. They don't know. They have no idea. This is the first time they're doing something. And so when there's not someone there to answer their questions, then they become very upset and anxious, and it adds a layer of stress to the pregnancy that shouldn't even be there.
like I said, once again, I'm just floored to find out all of this information because, of course, when people, and I know I'm not the only one, so stop looking at your radio like y'all think I'm crazy. But the bottom line, when people hear midwife, they don't think of the technology. They don't think of the blood work. They don't think of all of the traditional or modern medical practices, should I say. They may think, hey, what are you doing? You know, you just putting beads in a bowl and saying, hey, let me see what the beads are telling me. You know, that's the mindset in some cases. You know what I mean?
That's why education is so important.
Exactly. This is enlightening for me,
Yeah.
you know, to be totally honest. Like I said, because, you know, several years ago with my client, this would have been a great resource because I feel as if what you do is you bring someone in, you sit down and you talk to them, and it's not the lights of the big hospital, you know, that, like I said, she had that anxiety and she was really, you know, she was fearful because, like I said, she lost a mother, she lost a grandmother, she lost a sister. All, like I said, it was a very short period of time, and she had developed this mindset of, I'm not going in there, I'm not going to the doctor, but being able to talk to someone in a smaller situation, because at that time I was talking to some other folks about some concierge services in terms of practices and all or whatever as well. And so I was explaining to her that there are other entities that have concierge services whereby it's not a part of the, you know, the big medical practice or practices, should I say, but you have people that are in these, you know, kind of concierge types of practices where you could go and see a dentist, you could go see a primary care physician, you could go see a podiatrist. You know, all of these folks kind of gotten together, and they don't fall under the traditional, you know, larger medical practices. So this is good. Mm-hmm. This is definitely good. I wanted to know in terms of your training, because you said you went to school, you did the nursing component, but then also the midwifery. Did I say that right?
Yes, you did.
All right,
That's
all
it.
right. I'm learning. I'm growing, people. I'm growing. So you did the midwifery training as well. What if, you know, where would someone go if they wanted to get into this type of field or specialty?
So there are several midwifery programs in the nation. I'm trying to think. The closest one to here, Georgetown University has one up in D.C. East Carolina University is in North Carolina. Many come through Frontiers program because that's a distance program. A lot of our programs are actually distance programs, but you can always refer to the American College of Nurse Midwives website, that's midwife.org, and look up the programs. So, and that's, like I said, the pathway that I chose. As a CNM or a CM, you can look at those programs. It's a master's program. That's the entry into our practice. If you would like to become a certified professional midwife, there are two routes to that. Some people do what we call the PEP process, which is a portfolio education process, or they can go to a MEC accredited school, which is yet another program. There is not a degree requirement per se with the MEC accredited schools, but you are able to sit for the NARM exam when you come through those processes. So there are several ways to come into midwifery.
That sounds good. I want to go back just for 1 second because in my mind, I'm sitting here as I'm eating this good bacon, thinking about the different things that happen in your office. I have two questions regarding your office. So I know you said you do a lot of testing. So they can do is sonograms, you can do all those type of things as well. Fantastic. Then when they go into your office, what does your office look like? Is it anything different about your atmosphere? You mentioned time-wise, that is something that they get extended time, they feel that connection. But for someone like you mentioned, your client, Dr. Mason, who was uncomfortable about the hospital setting, because you still do a lot of the same things that happen in a hospital, what makes your setting different other than the time aspect?
So I had one of my clients tell me, actually it was one of the fathers. He said, you know, Miss Nikki, coming in here is like coming to my auntie's house.
So they don't call you doctor. He said Miss Nikki.
That's what some of my clients, they call me Miss Nikki,
Okay.
Nicole. Ms. Wardlaw, whatever. But for me, I'm just Nicole, the midwife. You can call me that.
So that's different than a hospital setting.
Oh yeah, you don't call me by my last name. This is a relationship. We have a partnership.
You become family.
That's exactly what I tell people. I said, welcome to the family. And so when you come into my office, it has artwork up that reflects the people in which I serve. I like to have my aromatherapy going. I usually have some music playing in the background, Crown Royal Radio, Jill Scott, Pandora, whatever. I let families come in because I feel like that's important. And so the kids have something that they do. There's like a little activity thing for the kids. Usually on the TV, I can put whatever, cartoons or something to entertain them, so families don't have to feel stressed about whether or not
can't
they
come
can bring,
because I need childcare.
Exactly.
Right.
Bring your babies. Bring the kids. The kids come in the room. They listen to the baby's heartbeat as well. So it becomes a family affair. It's not just a real cold and impersonal visit. When we visit. And we talk and we see how things are going and all of that. It's not just let me measure your belly, listen to the baby, and send you out your way.
You also mentioned that you don't just work with women specifically, even though midwifery says with women. You said you work also with the LGBTQ and transgender specifically communities. Tell us a little bit about that.
So that's just an area of interest that I have. And once so let me back up a little bit. Prior to my entry into midwifery, I used to work for an AIDS service organization. And so my heartstrings and my area of interest really is HIV, AIDS, STI prevention, education. I'm like the bug hunter of the midwifery group. I'm that person who likes to look under the microscope and diagnose things and treat and make sure that everybody's good. And in one of the clinics that I worked at, it was a Ryan White program. And so it used to make my heart happy when I had women who are HIV positive who could get pregnant. And helping them to get pregnant, which in a way that it was safe. Especially I had one client who was positive, her husband was negative, and so we worked on how could she get pregnant without him being exposed. There's been so many strides now that what we did way back then, things have changed now. But at the end of the day, this was someone who was told that she couldn't have children because she was HIV positive. And so, yeah, like that was really my area, and that's how I got exposed to the community.
Did she have a baby?
Yeah, she did.
Okay,
As a
that's
matter
what I
of fact, she has at last check, she had 2. I was there for her first pregnancy, delivery, and then when I relocated, she had gotten pregnant again.
Where do you deliver your babies?
So my practice is a home birth practice.
Okay.
So one day I will be blessed with a birth center, but right now I'm doing home birth. And I firmly believe that if a person is healthy, they don't have to be in a hospital. Sick people are in the hospital.
How do you determine if it's an unhealthy pregnancy?
Anything where that baby may require some assistance after they're born, they need to be born in a hospital.
So you do refer when necessary. Okay.
Absolutely. If they risk out, I'm saying, you got to go. So, for example, if a mom develops diabetes where they need medication, if they become hypertensive, which is big in our population.
It happens frequently.
But we do a lot of things to ward it all away. But if they do develop high blood pressure or preeclampsia, then they get referred to the hospital system. I have to risk them out because we can't do that at home. They need an induction because of something that's happening medical. Or, like I said,
so you're not inducing labor.
Oh, no, I don't induce. This is all normal physiologic birth. If you want to have a home birth, it is all normal physiologic birth. You go into labor on your own, and you have that baby on your own.
No epidurals?
Nope.
Whoo, Jesus.
Don't do epidurals
Send
at
me
home.
to the hospital,
I tell
Father.
people, I said, look, anesthesia is not here. The NICU is not here. That is just me, my
I needed
team.
to ask those questions for clarification
But
purposes.
you would be surprised.
Yes.
You would be
What they
surprised.
call Auntie
the
Nikki?
strength.
You lost me there. I'm gonna tell you right now.
Listen, you would be surprised. I've had clients who did not even realize the strength that they had.
I believe you have to tap into your ancestors.
Yeah.
Because you calling Jesus and his ancestors.
I had one lady that, I could share this. She said, okay, because this was hospital. So I do work part-time at the hospital as well. I work part-time at Centera Midwifery Specialist. So we started, it's the first midwifery practice that's hospital-based in our area. So I was a part of the team that started that. So I always got to give them their credit. And like I said, I work part-time there. And so I've had clients. One client said, I said, well, what are you going to do? She said, I'll get an epidural. I said, okay. I said, when you going to get it? She said, I'll probably get it when I'm about 8 centimeters. I said, okay, no problem. Just, that's the plan. You here, you doing your thing. And so I knew that she needed some help. And I called in a friend, had a doula come in to support her through the process. And
so you refer to doulas too and bring them in and say, okay, listen, I need you to hold this chick's hand right here.
Absolutely.
Okay, got you.
I work hand in hand with my doulas because my doulas come in and they work miracles. And so the doula came in, worked with her. I think she did some drill sergeant-y kind of stuff. I know that we was on a timer and I had to step out. I said, let me let you do your thing. Well, before I knew it, Mom was complete and ready to push. And she had surprised herself because she was waiting on things to kick in where she was going to get this epidural. So I go in the room. I said, well, we ready. She said, ready for what? I said, you ready to push? She said, hold up. What you talking about? She said, I ain't get my epidural yet. I said, well, the baby is coming. She said, wait a minute. Give me a minute. Give me a minute.
Let me wrap my head around this magical change.
She said, so what are we going to do? I said, how about this? We going to have a baby because you're getting ready to push. And she had to wrap her mind around the fact that she had gotten to this place.
She had gone too far.
She didn't know.
She had missed her point.
Sure did. Pushed that baby out, had a fabulous, beautiful birth, and she didn't even realize the strength that she had in herself.
But she realized she was having that baby when she was having that baby.
Oh yeah, that's for sure.
Yes.
But I tell you,
she made it though. She made it.
It's those moments. Those are the moments. Like I call them the midwife high.
Yeah.
When you're sitting there, you're like, yes, girl, you did it. Okay.
Do you have kids?
I have 2.
You have 2.
I do.
All right. Well, you answered a couple of questions, because my question was about hospital privileges and stuff like that, or whatever. If you have someone, if you're in the midst of a birthing situation, and something happens, do you immediately get them there, and do you follow them there and kind of stay with them through the process?
So the way that transfers work is that if you're in labor, we go to the closest facility, and EMTLA, which is the law that says that they can't close you away, they can't shut you out because you're in active labor, and this is considered an emergency situation. So if we have a transfer, I transfer my clients to the closest facility, and once they're there, I absolve myself of their care. I'm there just for support. Because I've now turned it over to whoever is the provider on call at that hospital, and I respect their position as the provider in the hospital. So, and that's pretty much how the transfers work.
And so you would basically end up taking them through like the emergency department.
No, we go straight to labor and delivery if it's an emergency. So there are 2 types of transfers: an emergent transfer where they're coming in via EMS, where we've mobilized emergency services. EMS is picking them up. I'm meeting them at the hospital because it is now an emergency. Knock on wood, we don't have those. And I have yet to call EMS except for one time. So praise God for that. And we're going to knock on wood because we don't want to have any of those issues. They're called urgent transfers, where I need to get you to the hospital, but it's not quite an emergency, but there's a red flag. There's something that I'm not comfortable with, whether the baby's having decelerations or something is going on where we need to get you to a facility that has a higher level of acuity care. So we do those. And then non-emergent transfers, which is a lot of transfers for home birth clients, is when mom is just exhausted and she wants an epidural and she says, look, I don't want to do this no more. So they say, look, I'm out.
Take me out, coach.
Right. Exactly. They say, take me out the game, coach. I'm tired. And that happens a lot, and that's fine. And even when it's a non-emergent transfer such as that, I always respect the decision of the mom or the birthing person. And I say, okay, so what do you want to do? They're like, I need an epidural. Okay, well, that's fine. So I make the phone call, arrange the transfer. And I always say, well, do you want me to go with you? And if they want me to be there with them, I will be with them because I'm the person that they know, you know?
Do you work with the families after birth? When we talked to some doulas, they were talking about how they help work with the families afterwards. So,
yeah, I might not have done the delivery, but I do their postpartum care.
Okay,
and I'm still present. I get text messages and phone calls at 2:00 in the morning.
Ooh.
Hey, this is what's going on, but I'm available. I tell people I'm here for you. It's okay. I'm available. What do you need? If it's something that could wait till the office, and I say, look, we'll talk about it during office hours. But sometimes if someone hits me up in the middle of the night,
they're up.
They're up and they're stressing about something, and it might just be reassurance. Reassurance goes a long way.
You give tips about the babies and sleeping and how to help them adjust to.
Absolutely.
Gotcha.
And if I can't help them, then I'm going to give them a resource. I will tell people I'm not a breastfeeding guru. That is not that's not my lane.
Ministry.
It's not my ministry. I support breastfeeding. However, I have people that I reach out to that absolutely love it, and they work miracles.
Real quick, so you do home births. So that means you go in, you help set up the place in the house where they're going to actually have the birth at home.
Yes.
Okay.
In the water too? You do water birth?
Absolutely, we do water birth.
You got the pool. You get the baby pool out there.
We get the pool set up when we do all the things, and water birth is this.
And you get in the pool.
No, I don't get in the pool.
Okay, I was going to ask.
Oh no, ma'am, no, I don't get in. No, I don't get
fluid flowing in that pool.
Right.
No, I don't get in the water. The mamas and the birthing people, they get in the water. I just have the long gloves all the way up to my ears so that I can reach in.
So do you boil the water too? Is that really a thing?
There's no. So
You said that 8 times on the show. So
I know, no, there's no boiling water. Listen,
you're going to answer that question. I want to know.
No, so the only boiling water that we ever use is when we need to sterilize instruments. Yes, there's boiling water for that. But when babies are coming, no. The only things that we have, so if it's a water birth, then I have a birth assistant. I never go to a birth by myself. I do have an assistant that comes and they help with the setup, the cleanup, and they're an extra pair of hands, eyes as well. Like if baby comes out, now I have 2 people that I have to pay attention to. So if I'm paying attention to mom and she's having bleeding, then my assistant is looking at that baby and making sure the baby is stable, and vice versa.
Gotcha.
And so, but when we do the water birth, there's a hose. I always tell them, get the potable water hose. You can't use that garden hose because it got lead and all kind of crazy stuff in it. And we connect it usually to the shower, and they'll run it into the birth tub, and we get just enough in there. And sometimes you do have to boil water in order to add more to it if their water tank doesn't support the amount of water that's
hot water that's necessary. Gotcha.
But my tubs have to, when you get in that water, it has to be a certain temperature. We don't have babies coming out in cold water. It has to match or be a little bit warmer than your body temperature. And them little boogers come out in that water, and they do just fine. They come out just fine. I am very hands-on, but I've had clients say, I want my baby to come out on its own, like I don't help them do anything, and they'll push their babies out in the water and they'll pick their own baby up and grab them. That has been a learning process for me because I've been doing this a little bit. This is my going on 19 years of practice, and so I had to learn to be a little hands off with my home birth people because they like to do things themselves many times.
Yeah, that's not me.
If
Do you
y'all could
ever
see
have,
her face when
like,
she
breech-
said, "That's not me."
breech babies? Yeah, I need hands on. Somebody need to catch this baby. You understand?
So
But
I did the
do you-
breech training.
Okay.
I did the breech training. I have not been blessed with a breech baby yet. In all of this time, I have not had a breech
That
baby.
is a blessing.
So,
Because
but
that would be a complication, right?
not necessarily. Not necessarily. Breech babies come. It's just a variation. But I did the training because if I ever was presented with a breech baby, I want to make sure that I know I know what I'm doing.
Trying to turn that baby around to get.
They'll
Just-
come out butt out.
Woo.
They will come out breech. And there are several. So in Virginia, you can do breeches, you can do twins, and you can do home births after cesarean.
Really?
Yep.
So you have clients that have had a cesarean and that are now coming in to do home births with you.
Absolutely.
Ooh.
But I will say the caveat to that is you definitely need to screen well. So I will not take someone who's had more than, if they've had 2 or more C-sections, they're not a candidate for me. Another midwife might do it, but they're not a candidate for me. If they have an incision that looks like a T, they're not a candidate for me. If they've had a classical incision, they're definitely not a candidate. But one prior C-section, low transverse, and it's been about 18 months to 2 years before, and also depending on why. Did they have the C-section because the baby was breech? Did they have the C-section because of, something else? Baby had, wasn't what we like, there had decelerations or something like that. It had nothing to do with the mom's pelvis and her ability to push a baby out, but there was some other factor, then I'm willing to do a trial of labor.
Well, after birth, I know we talked about some of the care. I've worked with women dealing with postpartum depression and all. How do you handle that with your practice?
So one of the groups that I definitely have aligned myself with is Postpartum Support VA. They have a lot of resources that they will deploy. Everything from postpartum doulas, meal preps, peer counselors, mental health resources. I try to work with my clients before we get to that place. So during their prenatal period, we talk a lot about mood disorders, especially if they have risk, and how we're going to try to ward that off. And when they have the baby and we see signs, then I start saying, okay, here are some resources I need you to call. What is it that you need from me? Because rest is important. And I'm like, you cannot be super person right now. I need you to focus on being a parent. I need you to focus on resting, that you're not doing all of the things that right now self-care is important. So, yeah, but doulas, like I said, postpartum support, VA, mental health resources, deploy all of that. And if I have to go show up at your house and say what's going on, I'll do that too.
And that's important. I know I was talking with an OBGYN a few years ago, and we're just talking about the whole conversation that they have with women, expecting mothers, about postpartum ahead of time. Just having these conversations and, some of the pamphlets and stuff like that or whatever. And that to me is certainly excellent care because, of course, when you find that women who are, pregnant, this is something that happens on a regular basis, and they oftentimes may not recognize the signs of depression and what they're dealing with and stuff like that or whatever and all. And so that is excellent. So,
and depression doesn't always look like sadness.
Correct.
So when I have a new mom who is not bonding with the baby, is overwhelmed, angry, frustrated, I said, okay, what's going on? Let's take a few steps back. What's going on? Are you eating? Are you resting? Are you taking care of yourself? Well, I have to do this. I said, no. And one of the rules that I tell my new mamas, they got a 5-5-5 rule. 5 days in the bed, 5 days on the bed, and 5 days around the bed. Meaning that these first 5 days that you've had this baby, you should be in that bed resting. Whoever is there who wants to come and support you, they need to be bringing you meals. Okay? So the only thing you have to do is get up out the bed, go to the bathroom, and come back in your bed. On the bed, okay, well, maybe you could sit on the bed, you can move around a little bit, you can do some things. You're not tucked in. And then the around the bed is you're not really leaving your bedroom too much to do anything, so that you are resting. And that baby should be skin to skin, and what I like to call it a habitat, right in that little nestled area on their chest. That's where your baby's going to be, because your baby's going to transition that place, and you will transition as well, because this is where the bonding starts.
Listen, before we wrap up, because we are running out of time, you have a conference.
Oh, yeah.
You have a conference. And we need to let people know a little bit about that conference, how they can attend, how they can participate, how they can support.
Okay, so let's see here. So, yes, this is the first time that the National Black Midwives Alliance is having an in-person conference. What we did is March 14th is designated as Black Midwives Day. So there's a whole campaign to have that be a national holiday. We need to honor the Black midwives and the contributions that they've made. But our conference is going to be right in Hampton at the Landing. It's March 15th through the 17th. More information, you can go to the website, blackmidwivesalliance.org, and find out about registering to come to the conference. We have pre-conference workshops. We have education sessions. We have a healing space. We have an elder circle. We are really taking this time to honor Black midwives. So this is a for us, by us type of conference. However, people can come and participate. If you are an ally, if you are an accomplice, if you believe in midwifery and supporting us, then I invite you to come. For those people who cannot attend in person, we are taking sponsorships and donations because we definitely, one of the two things that we are trying to do is we want to make sure that students are able to attend and our elders are able to attend. So we take donations so that we can support students and elders to come.
What is the cost of the conference? So for those who would like to donate or support,
I think our conference is $350. The cost of it to attend is $350. Don't quote me. And Kim, if you're listening, don't yell at me. Kim is our program director.
she's like, she asked me on the spot, Kim. But yes, they can still go on site and they can check that out for themselves.
Question, because you mentioned students. At what age would you say is appropriate for someone who may want to get into this area?
When you graduate from high school.
Okay.
Then you can start even in high school. You know how we have kids in these training programs? I don't think that you can be licensed legally until you're 18. However, you can apprentice, start out. I would love to even see programs in our high schools where we're, like these vocational programs where we're teaching them about doulas, birth assistants, any type of birth workers, so that they can get their feet wet and come on in.
Deliver babies, not make babies. I'm
exactly, keeping it real. That you be a part of a workforce. And
good training. I mean, that's two things for certain. We're going to live and we're going to die. So therefore, they will always have a job if they become great at that.
Exactly. Absolutely.
Well, this is awesome because, like I said, I know even when we look at young people, and I brought up asking in terms of the age, because I know there are some programs in the schools, at the high schools, that look at the health sciences. And so whether or not midwifery is one of those areas that would be considered or should be considered for them to take a look at is a thought. And I would say, I don't know if you all are providing this type of education, because, I mean, we've just gotten a glimpse here at the table today. But moving forward, is there some place, if someone was looking for resources to maybe start a program or get some education in terms of being able to kind of spread those things around, where would they go?
Call me.
Okay.
Call me.
Put your number out there.
757-439-7406, 757-439-7406. That is my personal number. You can call me if you have questions about this. I would love to see a HBCU have a midwifery program. A bachelor's level program for our CPMs, a master's level program for the CMs and the CNMs. I would love to see this. I have been we have developed webinars, teaching tools, all kinds of things so that schools can see the benefit of having a midwifery program housed at their school. And I'm even willing to go to the high schools and talk career day, whatever you need. I'll come talk to the health sciences class. Even the schools here, if it's the BSN program, I'll come and talk to the class about midwifery as an option because we need more. I always say we need more soldiers on the front line. If we're going to turn the tide of the Black maternal health crisis, we need more midwives.
And we don't have any midwifery programs. I'm going to say that. I'll get that word right. Midwifery programs at an HBCU currently.
Not one.
I know when we need to start.
Listen, come on.
We need to start.
Come through Hampton, Norfolk State, Virginia State.
The standard of excellence. You better understand.
Come through. I mean, really and truly, that's my dream would be to have it housed right here in Virginia. I would love. I would even probably take a step out and be on faculty. Because I believe in it that much
it would take
do that. I would do it in a heartbeat. But I do know that the possibilities are out there. We did have programs. Tuskegee University was one of the first midwifery programs in the nation, and they no longer have that program. Charles Drew in California had a midwifery program, and it is no longer there. But we need to have it.
Well, thank you so much. I've enjoyed this time at the table. I tell you,
yes,
I've learned a lot, and it's certainly been eye-opening to find that midwifery is more than boil some water and get the towel. So
okay.
Thank you. So, but I am Dr. Richard Mason.
I'm Dr. Tamara Williams.
And thank you for joining us right here at the table. WHOV Smooth 88.1 FM.
The essence of HU.
Keep you forward.
Someday we'll be able to measure the power of words. I think they are things. I think they get on the walls. They get in your wallpaper. They get in your rugs, in your upholstery, in your clothes, and finally into you.
Thank you for joining us at the table.
Tune in next Sunday at 1 p.m. for more delicious topical recipes for life on the Sunday Brunch.
On Smooth 88.1 WHOV.